Glaucoma Anatomy and Physiology. Applied anatomy. The ocular structures that are concerned with glaucoma include ciliary body, angle of anterior chamber, and aqueous outflow system. Let's see one by one all the three structures. Ciliary body. Ciliary body, we can see the ciliary body in the diagram. Ciliary body is a muscle which produces aqueous humor. Aqueous humor is present in anterior segment of it is present in both anterior chamber and posterior chamber of anterior segment of eye. Angle of anterior chamber. It is formed by root of iris, anteriormost part of ciliary body, scleral spur, trabecular meshwork, and squall base line. We can see squall base line, trabecular meshwork, and scleral spur in this diagram, as well as iris in this diagram. I highlighted the iris and all the structures of angle of anterior chamber. Angle of anterior chamber structures can be remembered by mnemonic I can see till squall base line, where I stands for iris root, C stands for ciliary body, S stands for scleral spur, T stands for trabecular meshwork, and S stands for squall base line. Aqueous outflow system. It includes trabecular meshwork, Schlemm's canal, collector channels, and aqueous veins and the episcleral veins. We can see episcleral vein. We all know that this is cornea and this is sclera, and the vein present just above sclera is known as episcleral vein. Let's see in detail. Squall base line. Squall base line is a white line present at the termination of Descemet's membrane and trabecular meshwork. Let's see in detail about aqueous outflow system. The first one is trabecular meshwork. Trabecular meshwork, it have three layers. They are uveal meshwork, corneoscleral meshwork, and juxtacanalicular meshwork. The three layers of trabecular meshwork are given here. Uveal meshwork, it extends from the iris, root, and ciliary body to the squall base line. Corneoscleral meshwork, it extends from scleral spur to the lateral wall of scleral sulcus. It consists of sheets of trabeculae that are perforated by elliptical openings which are smaller than those of uveal meshwork. Juxtacanalicular meshwork, it forms the outermost portion of trabecular meshwork and consists of juxtacanalicular space, which is filled with ground substance and cells. This is uveal meshwork and this is corneoscleral meshwork, and the last one is juxtacanalicular meshwork. Schlemm's canal, it is an endothelial lined oval channel present between trabecular meshwork and aqueous vein, having interscleral plexus. Collector channel, these are also called intrascleral aqueous vessels. They can be divided into two systems. They are direct and indirect system. Direct system is formed by the larger vessels which run in a short intrascleral course and terminate directly into episcleral veins. The larger vessels are aqueous veins. An indirect system is formed by smaller collector channels which form an interscleral plexus and finally into episcleral veins. Direct system is a short route and indirect system is a long route. With the collector channels are clearly seen in this image. Sclem's canal of is present all around eye. This is all about aqueous outflow system. Let's see applied physiology of glaucoma. It is concerned with the dynamics of aqueous humor, its production, drainage, maintenance of intraocular pressure, volume of aqueous humor in anterior chamber is 0.25 ml and in posterior chamber is 0.06 ml. Functions of aqueous humor are maintenance of intraocular pressure, metabolic and nutritional role. It provides nutrition to the structures present around it and it removes metabolites from the avascular cornea and lens. Optical function, it maintains transparency. Clearing function, aqueous humor serves as a mechanism to clear blood, macrophages, remnants of lens matter and products of inflammation. Refractive index of aqueous humor is 1.336. Composition. Water consists of 99.99% and solids is 0.1%. Because of blood aqueous barrier, the protein content of aqueous humor is 5 to 16 milligram percent and which is less than plasma, which is having a protein content of 6 to 7%. But in case of inflammation of uvea, the blood aqueous barrier is broken and the protein content is increased. Aqueous humor formation. It is formed in ciliary process of ciliary body. The normal aqueous production rate is 2.3 microliter per minute. The three mechanisms are ultrafiltration, active secretion and diffusion. Before it, let's see 3 points. Aqueous humor in anterior chamber versus aqueous humor in posterior chamber. The composition of aqueous humor in anterior chamber differs from that of aqueous humor in posterior chamber because of metabolic interchange. The main differences are bicarbonate in posterior chamber aqueous is higher than in the anterior chamber. Chlorine concentration in posterior chamber is lower than the anterior chamber. Ascorbate concentration in posterior chamber is slightly higher than that of anterior chamber aqueous. The composition of aqueous is similar to plasma except that it has high concentration of bicarbonate, chloride, ascorbate, pyruvate and lactate and low concentrations of proteins, urea, glucose, sodium, potassium, calcium. The protein composition of aqueous include amino acids of aqueous humor is about 5 mg per kg water. Non-colloid constituents are in millimoles per kg water. They are glucose, urea, ascorbate, lactic acid, bicarbonate, sodium, inositol, etc. Let's see aqueous humor formation. The first step is ultrafiltration, which constitute 20%. The second step is active secretion, which constitute 70%. The third step is diffusion, which constitute 10%. Ultrafiltration. We all know that this is the ciliary body and let's see zoom the structure. This is a ciliary process of ciliary body. It is having an internal limiting membrane pigmented epithelium and non-pigmented epithelium blood vessel stroma. The first step of formation of aqueous humor is ultrafiltration. The plasma substances pass through capillary wall and loose connective tissue. The plasma filtrate accumulates behind the pigmented and non-pigmented epithelium of ciliary process. In this way, ultrafiltration happens in ciliary process of ciliary body. Active secretion. Let's zoom the non-pigmented epithelium. The non-pigmented epithelium is having tight junctions between them. Through these tight junctions, the aqueous blood barrier is present. It prevents the transport of plasma filtrate across. We already discussed that plasma filtrate is accumulated behind the pigmented and non-pigmented epithelium. The tight junctions prevent the transport of plasma filtrate across. However, certain substances are transported actively through sodium potassium activated ATPase pump, calcium voltage gated ion channels, and carbonic anhydrase enzyme systems. What are these substances? They are sodium, chloride, potassium, ascorbic acid, amino acids, and bicarbonates. The third step or the final step is diffusion. Sodium is primarily responsible for the movement of water into the posterior chamber. In Schlemm's canal, there occurs sufficient diffusional exchange with the surrounding structures. As a result, the anterior chamber aqueous resembles plasma more than posterior chamber. We already discussed this point in the differences between the aqueous of anterior chamber and posterior chamber. So basically, because of sodium, there is movement of water into the posterior chamber. Hence, the difference occurs because of diffusion. Control of aqueous formation. The factors which control formation of aqueous include diurnal variation in intraocular pressure. Vasopressin and adenyl cyclase are also the factors which affect by influencing active transport of sodium. Drainage of aqueous humor from posterior chamber to anterior chamber through pupil. From anterior chamber, there are two routes. They are trabecular conventional route and uveoscleral or unconventional route. We can see in the diagram, if the aqueous humor flows through this route, it is known as trabecular or conventional route. If the aqueous humor flows like this, it is known as uveoscleral or unconventional route. Trabecular or conventional route consists of 75 to 90% contribution, and unconventional or uveoscleral route consists of 10 to 25% contribution. Trabecular meshwork. From trabecular meshwork, it flows through Schlemm's canal and collector channel. From ciliary body, it flows through suprachoroidal space, venous circulation of ciliary body, choroid and sclera. As we can see in the diagram, it passes through ciliary body, choroidal space and sclera. In this diagram, clearly we can see the route. Thank you.